Kuzampula. Taridi, let's get really into Gala. I'm talking to Dr. Phub Tshering. So if there's anyone who might want to ask questions or not, please hang around. Please share this live. He's a doctor from our hospital. Any question you can ask. Okay, later tama Q&A session. Can you invite the neurosurgeon? Dr. Songjam, so yeah, I've asked him. He's taking a break right now. So once he's ready, maybe that time. Let's wait. Come on, Dionchu say. Who's Dionchu? Do you have guests? Yes, I have. I have a guest. Can you invite me also? I'm also a content creator. Dionchu logaina Dionchu say. Kachibega Dionchu. Tatu ding let's get real in there. Say what you mean chanzena. Pindarika Yiketaya. Oh, okay. Kusampula doctor.
Hi, Bema.
Hello la.
Can you hear me, Bema?
Yes la. Your camera works, doctor?
Yeah, I can.
We can't see you la.
Oh, I put on my video.
Can you see yourself la?
Yes. Now, okay.
Can the viewers see
I can see
doctor?
myself in the...
I can't see you la.
Oh.
No, Lola. People can't see you also. Would you like to rejoin la, doctor?
Sure, I'll do that.
Okay. And TikTok live di mo atara nga. Dolong pimlo. Kuzang pula.
Hi, Bema.
Hello la, Doctor Z.
Can you see me now?
Yes la, very clearly la. I'm almost getting nervous la, talking to Doctor directly on TikTok live like this. So Doctor, Dato hospital na rajuya la Dato.
Yes, I'm still in the hospital for my
So
office.
I hope I'm not interrupting you la Dato na.
No, I'm done for the day. So if I go home la.
Last la. Thank you la. Firstly, thank you so much la, Dr. Phub Tshering Mola, for agreeing to come here and talk to us. I have so many questions, some of which I've already sent you. There's so many questions, and I know that there will be some viewers with their own questions. Now, this is a platform that I started some years back. It's called Let's Get Real, where I talk to people, hear their story, seek inspiration, get inspired, and all that. But today, I am so honored to have Doctor who sits in the intersection of leadership, policy, and frontline medicine, agreeing to come here and talk to us. So, thank you so much, Doctor.
Yes, thank you la. Thank you so much for the opportunity la. As I was just strolling through TikTok, you have so many followers, and I think you have really made an impact through your channel la. So it's always a pleasure to join such a platform and then share a perspective, I think, which may be relevant to some of the viewers la. So this is what I'll strive to do.
Thank you, la. And also, Doctor, this is a very informal conversation, Doctor. It's not like one of your, some formal like BBS type of interview. Some baby thing. Some do the telekara theme supla. So thank you, la. So before we begin, la, if I may ask Doctor to, if you can share your story as a little boy and your journey till today la, with your introduction.
Thank you la. Once again, thank you for the opportunity. So I'm Dr. Phub Tshering la. By profession, I'm basically an ENT surgeon, an ENT specialist, and later on I subspecialize in head and neck oncosurgery, head and neck cancer surgery. So currently I am working as a clinician, and that is mainly as a head and neck oncosurgeon. Then I'm also working as the medical director of the National Referral Hospital for last 3 months now. So as you said, how I actually came into medicine and how I started my career in medicine. So I was born and brought up in Parola, and then I did my primary schooling and even my high school in Parola. So those days when Rugal High School first started as one of the newest high school in Bhutan, that's where I got the opportunity to study at Rugal High School. And then after finishing my class 10 in Rugal, then we had I wanted to take up science stream. So I have two options to choose. So those days we have either we can go to HS or we can go to Sherapse College. So I had the opportunity to study in to take up my +2 in Sherapse in science stream. So I proceeded to Sherapse for my +2 PU studies in science stream. So that's how my actually career in science started. Actually, I chose science in +2, and then I tried for professional courses, and then luckily enough, I got selected to pursue my MBBS in year 2000. So that was we are one of the first. We are the second batch to be actually sent to Sri Lanka to take up our courses, undergraduate course in medicine. So in 2000, I went to Sri Lanka to do my MBBS. And then I studied in the University of Kelaniya, which is the northern part of Colombo. So I did my undergraduate MBBS in Sri Lanka from 2000 to 2007. 2007, I finished my internship from Sri Lanka. And then I had the opportunity to come back and work in Bhutan as a general medical officer. But then I wanted to do my specialization straight away. So then I decided that instead of working as a general medical officer, I would rather go to specialize. So that's when I decided, and I went to Bangladesh to pursue my postgraduate or master's. So that's where I ended up studying, specializing in ENT specialized, ENT surgery in Bangladesh for another 5 years. So
My
I
God.
came back to Bhutan. I went, I went from Bhutan in year 2000, and by the time I came back, I realized that I've spent almost 12 years outside pursuing my medical courses, MBBS followed by my specialization in ENT surgery, and then 2012 I did RCC, and then from 2013 I started working as a ENT specialist at the National Referral Hospital. So those days, there is a vacuum in ENT field. I had some seniors who have by then resigned from the civil service. So I was the one actually to fill up the gap, that vacuum that was lying there in the field of ENT specialization. Then I started working as an ENT surgeon at the National Referral Hospital from 2013, and after then I worked here for 2 years till 2015. Then 2015 again I realized that I had to do some kind of subspecialization, because as an ENT surgeon, as I was working, I realized that most of the time I end up referring cases outside Bhutan. So basically, especially in most of the cancer cases that we had to see as an ENT surgeon, I found out that my role was mainly in terms of diagnosis, in terms of follow-up, but there's little much I can do in terms of treatment. So that's where I realized that now I think I better do some kind of training to treat cancers actually. So that's when I decided that I will pursue a fellowship in head and neck surgery, oncosurgery, cancer surgery. And then luckily enough, I got an opportunity to pursue my fellowship in Tata Hospital, which is one of the best institutes in India for cancer studies. And then I went to India in 2015 to do my subspecialization in head and neck oncosurgery from Tata Medical Center in Kolkata. So from 2015 to 2017, I worked as a fellow at the Tata Medical Center, at the same time doing my fellowship in head and neck oncosurgery. And then I came back from Tata. After finishing my fellowship again, I joined back to the National Hospital in 2017, around June, I think it's end of June. Then I again joined the department of ENT surgery, and then after a year, then I took over as the head of the department until last January, where I was picked as the medical director of the hospital. So in a nutshell, this is all about my professional journey.
That is like a lot of years lah you've spent. Lo halam chi pechata dira mula Dr. Gi. No wonder you are where you are lah. So huge congratulations lah, firstly on becoming a doctor, a specialist, oncologist, and now a medical director. La nam sami touch dili yu lah. Now mula,
Yes,
as a
yes.
medical director, like this is something that I've always wanted to ask lah, about the system in our hospital mula. Do you think, as a medical director, do you think there are some hidden flaws in our healthcare system in Bhutan?
Right.
Hidden flaws,
Right.
as a medical director, when you see, do you think so?
Yes. I think that's a very important question, because as we discussed, I think it will really bring up perspective, which is important for all of us to look at together, because at the end of the day, health matters for everybody. Whether you work in the hospital or not, but at the end of the day, health is something which matters to everybody. When you talk about health system, I wouldn't say as a flaw, but definitely I would look at the health system in two ways, lah. And that pertains to the way how the health system is actually designed over the period of years. So I think as we talk about health system, I think it's also important for us to understand the accomplishments that we have as a country made in health, how much we have progressed so far. So Bhutan actually, despite having very limited resources, I think we have done pretty well in terms of health, and that is as we all know that Bhutan is well known all over the world for the universal healthcare. I think which is an envy even to the developed world, even to countries like US, where people are struggling to have universal access to healthcare, despite being a very rich country. So Bhutan, I think we do have our limitations, but definitely universal access to free healthcare is one thing that we should really be proud of. And then we also had achieved so much in terms of public health system. For instance, we eliminated certain infectious diseases like malaria, polio. So we have done a lot of work in infectious disease in the past, where our whole health system was actually designed to cater to that kind of a disease. And we have also done very well in terms of developing infrastructure, for instance. Now, if you consider the access of care people are getting, as per the recent survey, almost more than 90% of our people have access to a health facility within 2 hours. Within 2 hours, they can reach a health facility and access that kind of care, and which is again by any international standard is very good, very good. I think this is what our people should also appreciate with regards to some of the positive things about our healthcare system now. And also, we began our health system, our health journey at a very basic level with hardly any medical professionals, with some very basic health workers who started the health journey in Bhutan, and we came a long way now. Today, if you look at our health services, of course, we do have our own challenges, we do have our own limitations. But if you look at the health workforce now, just for the doctors, we have around 450 plus doctors currently in our health system. We started with none, and now, after 3-4 decades, this is where we have reached. So it is actually a very proud moment for the health system, where those days, even when I was a student, when we go to the hospital, we are hardly seen by 1 or 2 specialists, and they're also very difficult to access. And we have generalists who deal with all kind of specialties. But now, if you look at the National Referral Hospital, each body organ has a specialist, and now we are even going to the level of subspecialist. We have organ-based kind of practice. We have a neurosurgeon who handles the brain. We have a cardiologist who handles the heart. We have a nephrologist who takes care of kidney. So even in terms of specialization, though we don't have adequate numbers, but we do have a breadth of specialty to focus on certain areas of the body, a specialized kind of work which is happening at the National Referral Hospital, which as a small country with limited resource, again, this is something that we as Bhutanese should be proud of, the way how we have progressed so far. And also in terms of prevention of infection. So as a country, we have done a great job in terms of vaccinating our population, our children. So if you look at the records in vaccine preventable diseases, we have pretty good coverage in immunization, much comparable to some of the developed countries, where were able to prevent vaccine-related, vaccine-preventable diseases. So, which is again a very good thing for the country in terms of prevention of diseases. So, looking at all these past, successes that we have in health, I think we did have a very good system, health system, which is designed to cater to that in that era, where our health system has done tremendously a good job in terms of tackling those challenges during those days. But now we are at a crossroad. So that's why I'm saying it's not a flaw in the system, but now we are at a crossroad where we are dealing with a different kind of disease burden. We are increasingly the quality of care is expected from health workers, where we have issues with attrition of human resources. So we do have issues with increasing cost of healthcare. So now we are dealing with again a different kind of challenges. So the question is, should we be satisfied with a healthcare system which is designed to tackle challenges in the past, or now should we take a strategic viewpoint to redesign our healthcare system so that we are able to face the current challenges, the current epidemiology of diseases that we face, the current the challenges we face in terms of human resources.
Yes.
So it is, I think, more than the shortfall of the system. I think it is how we relook at the system, and how we take this opportunity to redesign our health system in such a way that now we will succeed even in tackling the current challenges. And now, based on the current data that's available to us, it is high time that we relook at the way how we approach our health system from now onwards, and then take directions which will actually mean useful for us in times to come.
Yes. So is it under progress, la, Dato, to redesign the whole system and all that, la?
So now, I think, first of all, we should, I think, as the hospital people in the hospital where we are actively working, our work is basically focused on the day-to-day clinical practice, ensuring that we have currently in JD we have almost 22 clinical departments, all have to work in harmony with each other. So we have to make sure the clinical services are not hampered, are going on, and at the same time we have the policy directive, which is from the Ministry of Health. So we are basically implementing whatever policy being designed. So I think when it comes to designing of the health system, I think the lead role has to come from the policymakers, from the Minister of Health, who has a bigger responsibility of looking at health at a bigger picture, and see the current challenges and see how we can tackle this in times to come.
Yes. Yes. Thank you, la. Thank you so much, la. Since you've mentioned like workforce, mula the human resource HR say the machi hospital nalu, a lot of healthcare workers are leaving, la. Why do you think it is? Is it the workload, the system, the salary? Gachivi na la?
Yes. So again, that's a very common question being put forward to most of the health workers and to the people who lead the system. It is multifactorial. It is multifactorial. There are a lot of factors contributing to this, as you mentioned, in terms of finances, in terms of maybe it could be with regard to the system that we are living. It could be because of the cultural factors. But if you are to pick up one factor, then I have to be quite brutally honest. So it is all about money. Of course, it is about money, the major contributing factor. That is because, because right now as a country, our GDP is not that great. So our GDP is lying around 3,000 USD per capita income. So with that kind of situation, even the government is not being able to compensate the health workers well. So health workers in general feel that they are not well compensated based on the workload they have to put in, based on the number of years of training you have to undergo to come to this level. And then once you join the system, the kind of responsibility you have, the kind of work pressure you have, the kind of stress you have to go through. So based on all this, the input by a health worker, I feel most of, in general, health workers feel that they're not well compensated as per the package that they would actually deserve. So that is one of the main reason, I think, which has led to a significant attrition rate among the health workers, both in different categories, from among doctors, among nurses. Then, of course, as you said, it could be some other kind of maybe some systemic issues that we are currently dealing with, especially in health. There is a general belief that now, since all the health workers are under the Royal Civil Service Commission rule, the RCC, there is a general belief that the health workers are basically they feel that they are trapped in a system which is actually meant for the generalist, and not for the technical people, not for the specialist, but the system which is designed for the generalist. But somehow, as health workers, we are trapped in the system. That kind of feeling is running rampant among most of the health workers. So as a medical director, I had no hesitation in speaking out on behalf of the health workers, because we know the kind of sentiment that is running among the health workers.
Yes.
So, especially in terms of career progression. So currently, since we are put in one basket, when it comes to career progression, there's little that a health worker can actually look up to. So, especially because no matter whatever profession you join, at the end of the day, after a certain point of time, you always look for growth. You want to grow as a professional, and when your system is not designed to let that happen, then people feel quite suffocated, and that's where I think we need to again look at how do we, not only in terms of incentivization, but also how we design a system so that the health workers have a career progression, a proper career pathway which they can look forward to, and then give their best. And also culturally, as you mentioned again, because most people will avail health when they go through the most traumatic, difficult time, and societal expectation from the health worker is very, very high. And especially if you have gone out, and availed health service outside Bhutan, maybe India or Bangkok, you basically you will be availing health services from one of the corporate hospitals. And in the corporate hospital, the system is totally different, because basically, more than a patient, you are treated like a customer. So, of course, as a client and as a customer, you will be treated with all, the best of the services that's available. But then when you receive that kind of treatment outside, and when you come back to Bhutan and have to go through a public healthcare system, so that's where you feel the disparity. On one hand, you have availed service in the high-end corporate hospital, uh, ignoring the bill, just ignore the bill for time being, but just see the services from corporate hospital versus a public hospital, where we are again having our own challenges in terms of human resource, in terms of budgeting, in terms of a lot of other resources, constrained by resources. So despite all that, the challenge, the expectation of the public is very high. And if you look at the social media kind of the social media posts that you see in Facebook or any kind of medium, you'll see most of the things that are written on the hospital is all about the negative things. So some kind of incident goes wrong, then it becomes viral. So people are frustrated. They post on Facebook, and then as a result, the expectation from the health worker is actually quite pretty high, and that's kind of a cultural pressure that the health worker has to go through. So I mean, workload, the kind of burnout from overwork. So all these factors are actually contributing. But if you want me to pick one reason, then of course it is the financial incentive. I think which will really matter.
Yes. Thank you so much, La. Thank you. Since you've mentioned about public expectation out of Ngachiragi Hospital Namola,
Yes.
I've heard so many people, like talking amongst each other, or even telling me and sharing stories about Minkana juice, hoda yera baby se doctor. Doctor, the nurse, this and that is hoda ye say anusum gila. Why is that happening? I mean, I understand more the workload and all the pressure and all that. I understand they're working like 12 hours, 15 hours. But then kongi labna de like lochi lejim chi lab chiamba de gachilo, there is a saying that my father-in-law always says la. I wrote doctor dina me some nejim kogi khalap thangira neji di dhani me se. And not all, like reading in your devil, I have not personally experienced it, but Midusuyani, I've seen posts and all that. Like, why do you think that's happening? Like, because Ngachi, as Bhutanese, as like Buddhist, Chosembe and Zumuda, at least like Lochi di Lejimbe, Labachin se Anzumchi, no some knowing, la. Why do you think
Yes.
that's happening?
That's true. I agree your standpoint. We, as I was saying, we do have limitations of our own, and especially now this is with regard to the social skills, the interpersonal skills, and especially when patients come to us, as I was mentioning, they come to seek for help, and when a health worker, because of whatever reason, because of work pressure, because of stress, because whatever reason, when that interaction is not has not gone in a way that it should actually be healing for the other person. So when that doesn't happen, people feel bad, people feel angry, and then sometimes it comes out in the media. So that I think even as a hospital, as a community here, we always among ourselves also we discuss, and we when we analyze the things which appear in the social media, I think it's nothing to do with the kind of service that we're providing. It's actually all about a failure in communication, and I think even the current management, right from the president, we are really focusing on improving that, how to equip our health workers, within that, because communication is something. Some people, for some people, is natural, but communication skills is also something which is very important. But if it is not coming natural to you, then somehow it is a learnable skill. But unfortunately, although we may be trained in years and years in medical training, but the communication part, we hardly get any kind of training, although this is a very important aspect of the practice of medicine. So this is something which, even as health worker, I realize, and this is what, as a management, we are trying to deal with. But having said that, I think even if you look, I mean, now, of course, as I was mentioning, a hospital being a place where people come when during the most difficult time. So definitely things that happen in the hospital are noticed and they become viral, it's just very easy to notice things in the hospital. But generally, I feel that if you go to any kind of, even if you go to a shop, I don't think we are that good, especially when we deal now. If whether you go to a bank, or whether you even go to a shop to buy things, sometimes you have to tolerate the mood of the person who is actually doing business with us. If you go to a
Exactly.
bank, we are the client, we customers as the king, but you don't get treated that way. But as I was saying, the attention is more in the hospital, because that is something where people need it the most. And then when things don't happen the way it should, then it gets flared up. but in general, I think this is happening everywhere. Even if you go to fuel your car, waiting in the line, sometimes.
India. So the you better be Kati Juro. Yes, la, absolutely true, la, doctor. Just one last question on just like the hospital thing, la. Like
Yes.
not just in Bhutan, I am quite aware that this is a very common thing everywhere else. Misdiagnosis, la. Misdiagnosis. I think it's quite prevalent, not just in Bhutan, everywhere else. Misdiagnosis. Now, if it is a misdiagnosis for a minor illness, titu beba mula. But if it is a major illness, ki misdiagnosis chi beja, and then that person loses his or her life, mula. Accountability. Say, is there anything of that sort, la?
Yes. So again, a very important question, especially uh, when it you will be really stuck, especially if it happens to someone near and dear to your loved ones, and it can be really traumatic. But as you rightly said, La, first of all, now if somehow if you feel that a diagnosis have been missed or you have been misdiagnosed, if you have that perception, because as I was saying, the communication part is really important, because sometimes what happens is, uh, in general, we may not have the correct information. Sometimes it may be a miscommunication, but based on this little fact, sometimes things go out of proportion. So, you really have to fact check, like, whether it is really a misdiagnosis or whether it's a miscommunication where some kind of misinformation has occurred. But since you're pointing towards a remedy when it actually happens, now we are not an exception. So I do accept that sometimes things like that may be happening here, and as much as it happens elsewhere in developed countries also. So we are not an exception. Things might be happening, but we have normally, when if things like that happen, and if you are really sure that these kind of things has happened, then we have a process in place now, because as health workers we are all bounded by the rules of the medical council law. So the medical council who certifies our practice. So as a health practitioner, we have to keep on revising and renewing our health practicing license with the Bhutan Medical and Health Council, and they are the regulating bodies who oversee all these kind of clinical activities. And if you, as a patient, if you feel that something has not happened the right way, and you always, it's your right lah, to rather than posting on the social media, because sometimes it may be just the half truth. You may not have heard the other perspective. So when you say it's a misdiagnosis, it's a huge big term now. So you really have to first of all confirm that this is actually a misdiagnosis. Something wrong has actually happened, and if you are really sure that these things have happened, then definitely you follow the due process. You can make a written complaint. We have a Bhutan Medical and Health Council, and then we have a process wherein, when we have some such kind of complaints from the patients, then the Bhutan Medical and Health Council takes all the action. So they will do a thorough investigation. So they will make sure that, and they will form a committee, which has nothing to do with the case. It's a very fair and honest kind of investigation that they do, and then finally they will come back. So if not because of misdiagnosis, but some kind of negligence which has happened in the past. So our health council has actually come in and has reprimanded some of the health workers. So it's all about the process that you take in now. If you take the right process, but as I was saying, it should not be based on some half-baked truth or some misinformation. It has to be really confirmed to accuse somebody that, okay, something that has happened, and then if you follow the due process, everything will fall into place now.
Yes. Thank you, La. Thank you. I will not be asking any more questions regarding the hospital because I might have to visit the hospital and I don't want to be outcasted. Last, La. Doctor, what is one of the most underestimated health risk la, among Bhutanese today? What do you think is the most underestimated? Like,
Yes. So, as we were discussing about the health system and particularly on the disease pattern, so now at this juncture, now as I was saying, we are at a crossroad. So we have infection in the past, which is still prevalent, but then we have a new set of challenge, and that challenge is in the form of non-communicable disease. Infectious disease, it communicates, is spread from one person to another. But when we talk about a non-communicable disease, it's a set of disease which you acquire, but it does not transmit from one person to another. So that's why it's called non-communicable. So called under the umbrella of NCDs. So under the NCD umbrella, we have hypertension, we have diabetes, we have heart diseases, we have respiratory diseases, we have cancers. Some people even have the notion that cancer can spread from one person to another, but it's not true. So cancer is again one of the most common NCD or non-communicable disease. So NCD is one of the most hidden kind of thing that we are, which is now coming to the surface, and that is one of the most important challenge that as a health system we have to face. Because when we talk about infection is very short-lived. So either you recover from the infection or you don't recover, you succumb to the infection. So it's very episodic. It starts and stops. But NCD is not like that. So it's a lifelong disease. So non-communicable disease basically is a lifelong disease. So once you are stuck with that, then it remains with you forever. And in a free healthcare system, that's where the challenge comes. Now you have to maintain the treatment for the entire life course, and that's where your health expenses are increasing. That's where the government has to chip in a lot of money now. So NCD burden is hidden, and which we are facing now. But if you look at why NCD happens, so NCD is a group of disease which is basically you yourself play a huge role in that now.
Is it
At
the same as
significant
lifestyle disease, lah? Like what they
Yes,
say, like
lifestyle.
what they call
So
lifestyle disease?
yes, so the lifestyle factors, the kind of lifestyle that we choose, have a huge bearing on whether you will have an NCD in future or not. Now, just for example, uh, say if you look at the current statistics in Bhutan, it will be very shocking for you to realize that in 2019 the Ministry of Health has done a survey, the health survey, and they found that almost that the physical inactivity level was around 7 to 8%. Recently, in 2023, they did another survey and found that our inactivity level has increased to almost 18%. So basically, 18% of the Bhutanese are physically inactive.
Yes.
And when we say inactive, you are basically not into any kind of physical activity.
Yes.
And one of the main contributor of the NCD is lack of exercise, that lack of physical activity. Then we have issues related to diet. We know that even our conventional diet is not that healthy. We eat a lot of rice, which is again a lot of carbs, and ultimately it accumulates your body in the form of fat, and you become obese. So traditionally also not a very healthy diet. And now with modernization again, we are subjected to the same kind of dietary influences which is going around in terms of junk food, in terms of sugary substance, fried substance, lots of salt in our diet. So all these factors, dietary factors, again play important role for us to develop NCDs. And then finally we have this our own habits that we adopt.
Yes.
For instance, we have just example, Domala. Doma is culturally accepted. So this is something which I don't know when we will be able to tackle this, but we have to live with this. And for everybody's information, the viewers' information, Doma or the betel nut, it is a WHO grade 1 carcinogen. So carcinogen is a substance which causes cancer, and grade 1 means it is proven in humans. So currently, DOMA is causing at least 4 types of cancer, starting from oral cancer, oropharyngeal cancer, hypopharyngeal cancer, esophageal cancer, proven in those four cancers. And looking back at our data, almost 45% of our Bhutanese, they chew DOMA. And this is very embedded in our culture. Wherever you go, whether you go to the funeral or whether you go to a wedding, you get served. So it's something culturally ingrained, but at the same time, it has a huge implication in terms of health, of our people. And then we have increasing burden of alcohol. Again, this is a very, if you look at the mortality, why people die in Bhutan, alcohol is number one. Alcohol liver disease tops number one, because again it is culturally very accepted. uh, and free availability of alcohol, homemade drinks, all these are contributing to acceptance of alcohol as a norm. And again, in terms of health, we are paying a huge cost for this law. And if you look at our current referral pattern, we refer patients to India, and currently cancers are topping the list. So one of the main reasons why we refer patients outside Bhutan are cancer. And if you look at, most of these are your own lifestyle related contribution towards development of cancer. And you will be very surprised to know that from 2014 to up till now, we have spent almost 1.2 billion Multum just for the referring patients out. So you can see the amount of money which has gone inside, which has gone out from the government coffer to treat NCD, a non-communicable disease, which could easily be preventable by the choices we make. So indirectly, as a citizen, how much we are contributing, to the burden of the healthcare system through our habits. So that's why it is important for all of us to realize how individually we can contribute towards the rising burden disease that we all are subjected to currently.
Yes. Thank you, La. Doctor, since you mentioned NCD and lifestyle and all that, Mola, and cancer, I know a few people, very healthy, very active, balanced diet, like everything perfect, like exercise based gym, and then suddenly we hear he's got cancer. Like, is that possible? Like, why? How come they get, like, even
Yes,
though they
it's very much possible, because uh, cancer, actually, if you dissect why we get cancer, basically it is something to do with the genes. So our genes has not functioned the way it should. So that's why we develop a cancer. So cancer means some kind of growth happening inside the body, anywhere in the body. When there is a growth, it doesn't stop, and it keeps on growing. So that's, in a nutshell, that's what cancer is all about. And it's all arising from a defective gene. Now you consider two persons now. One is, say, person A and B. Now person A has a defective gene. Now he don't have lifestyle factors, as you were mentioning. He don't smoke, no alcohol, exercise regularly, everything, but then he has a defective gene. So although he don't have a lifestyle related kind of contribution for his cancer, but then because of his genetic issues, or a gene not performing the right way, he tends to have, he develops cancer. But you consider person B, who may not be having a defective gene, but because of all these lifestyle related factors, it is contributing towards the development of cancer. So my field, my area of expertise is head and neck cancers. So if you look at head and neck cancers, 90% 90% of the head and neck cancers are actually related to your lifestyle. So lifestyle means you're talking about alcohol, you're talking about betel nut, you're talking about tobacco. So if you can take care of these three factors, 90% of the head and neck cancers can be prevented. So that's how powerful your lifestyle can actually contribute towards development of cancer.
Yes. Thank you so much, La. Thank you. I never got this type of explanation. I tried to look up. Kate thita iwa la, but then thank you so much for this very wonderful explanation, La Doctor. Now, just again
Yes.
coming back to the healthcare situation, Mola. If nothing
Yes.
changes, how serious will the healthcare situation become in the next decade, La?
Plus. So again, a very, I think, useful question, thought-provoking, because somehow we have to act now. If you don't act now, then the situation is. I have no hesitation in saying that situation will be quite grim as we move along, especially in the next 10 years. If it doesn't happen, then we are headed for a lot of challenges in future. La. Now, just look at. Let us look at this in two ways. La. Now we have a disease on one hand.
Yes.
Now the disease pattern is changing. So in the past, we used to deal with infection, and we are still dealing with infection, but now we have to tackle the non-communicable disease, which is to remain for lifelong. Okay, so we have a changing pattern in disease. Infection which is going on. In addition, you have NCD, and now again we have another group of infection. These are called the antimicrobial resistant organism. So basically, we are talking about this is one of the most emerging healthcare issues all over the world. It is within the purview of infection now. So we are basically talking about those bugs or those bacteria who no longer respond to the conventional antibiotics that we use to treat them or kill them. So these organisms have gained resistance towards the antibiotics we have in hand. So basically, they are resistant to the treatment options we have. So those are the emerging infections which are resistant to the conventional antibiotics and which can create havoc in times to come if we don't tackle this now. Because as per the WHO prediction, between 2025 to next 2050, if we don't tackle it, almost 39 million people will lose life because of an antibiotic resistant organism. So we have a new emerging disease challenge even within infection, and on top of that you have NCDs, which is again causing a huge impact on the government's budget resources. And now on the other hand, you have a high attrition rate in health, the workforce. Now you have to talk about the workforce, people who
My
take care of the
God.
disease. So you have a workforce which is, where attrition is becoming a huge problematic for us now. So as I was saying, as we discussed about the reasons why we people leave the system and try and go out for greener pastures. So we have, especially among our junior doctors, because most of them they wanted to they wanted to be compensated adequately for the skills they have acquired with all the difficulties. So most of them they are planning to go out. They do licensing exam outside. They are just waiting for the bond to finish and waiting to go out. So we have a situation where disease burden is increasing and where we have a situation where the health workforce is shrinking. So now you can actually see the mismatch in the demand and supply. The demand is increasing and you will have a supply issue if you don't tackle that. So now we really have to intervene. I think this is the right time to intervene. That's why I'm saying we are at a crossroad of disease burden and attrition of health workforce. If we don't intervene right now, then we will have very difficult situation times to come. And I think we really need to have strategic intervention. We really need to retain our workforce. We need to motivate our health workforce, retain them within the country, incentivize them as per their workload, as per their expertise, as per the clinical excellence that they bring into the system. So it's high time that we, as I was saying, we really have to design a system where the health workforce have a dedicated career ladder system, a career pathway, because when you are treated in the same pool, that's where you are not really happy with the system. You really need to provide that kind of ambience for the health workforce for us to retain them, to give the expertise to the back to the country, so that we don't have a situation in future where we will lose many of them and then the country will suffer.
Thank you. Thank you so much. Namsami Kadiche. Actually, I did have a couple of questions, but doctor, you're looking tired and I don't want to keep you for too long. I'm sure you must have been at work from morning, Mola. So if there is anything that the viewers would like to ask doctor, maybe two questions, maybe. Mola. Viewers, this is your bachin questions. This is your bachin now direct betis Dr. Phub Tshering hospital. I was in the ENT thing la Kata yesterday. I was there and I was waiting for to get my son checked la. So I was just looking at the ward like who is in. The doctor was inside, but then I went to chamber number 2 la. Very nice doctor and I'm saying Lijimbe check up la. So I was quite happy la.
Good to know.
So if there is nothing that the viewers would like to ask, how does vaping affect an individual, Lola? And thyroid. Okay, vaping.
So vaping, it's again a new harmful thing which has come, and WHO has actually been raising awareness on that because vaping, again, it causes lung injury. Although we do a lot of marketing in terms of reduction in side effects or long-term effects, but now we have enough evidence to say that it causes acute lung injury. We have data from different countries to suggest where people, even young generation people, although this is marketed as a harm reduction alternative, but in reality it causes a lot of harm, especially in young children coming with acute lung injury when they are so used to vaping. So it is not at all without harm. It has significant harm, and there's enough scientific literature to suggest that it causes acute lung injury, and we have to really look at this seriously now.
Last lungs. Does it any popcorn lung simiche it does vaping cause that la where there's like bubbles around the lungs se anusumche khuisa la?
I mean, if you are frequently, that can be one of the end result, but this is not alone just because of vaping. There are some other conditions which can cause this kind of lung condition, but vaping is just one when you are repeatedly using. But there, as I was saying, there are other contributing factors for that kind of picture to happen in the lung.
Yes. Doctor, since we are talking about lungs, like most of us, me included, we are always lighting, like all the time. Does it have any adverse effect on our health?
So to be very honest, we don't have enough data to actually comment with all the authority on that. But all I can say is that it all depends. That is again very, very individual kind of thing, because sometimes you can be allergic to the contents of the incense that we burn. So if you are allergic to certain substances there, then probably you will have symptoms then and there. But in long term, we really need to have long term data to say that okay, this is actually harmful, because currently it's very difficult to say with full authority because of lack of proper data.
Yes. Ani doctor, since ani tonsillitis ki question chidusala risk of having tonsillitis once every year lola.
Yes. So tonsillitis is again something very subjective. Just because you have one attack of tonsillitis, it does not mean that you will have repeated attacks of tonsillitis. Some people, they will have 1 or 2 attacks in their lifetime, but some people, they will end up having at least 2, 3, 4, 5 attacks per within a span of a year. So it all depends from individual. What we have to realize about tonsillitis is if it is frequently if you are frequently suffering from tonsillitis, then it has to be addressed. It has to be addressed with surgery, especially if you have five attacks per year. Then definitely you are having very frequent attacks of tonsillitis. But just because you have a sore throat doesn't mean it is you are having tonsillitis. So typically, how a tonsillitis patient will present to you is you will have severe throat pain, you will have difficulty in swallowing, painful swallowing, even if you cannot even swallow your own saliva because it's so painful. You may be having high fever, and in children you might even be, you will miss schools. You have to stay home because of the pain and all the discomfort. So first of all, we really have to prove that this is tonsillitis. And if we
Yes.
prove that okay, you're having recurrent attacks of tonsillitis, then we have enough enough treatment options to treat tonsillitis. And as a free healthcare service, we offer tonsillectomy. It's the surgery to remove tonsils, and we this is one of the commonest surgery that we do in Bhutan here. Here now you recently one of my friend he joined the National Health Service in UK. So he's an ENT surgeon here, and he's now working in the in UK as an ENT surgeon. So he was telling me that here, when we had to do a tonsillectomy, normally we do within a month. But in his ward where he's currently practicing in UK, they have to wait for 2 years to avail that service. The waiting list is for 2 years. But
Yes.
but here, if somebody is having tonsillitis, I mean, we normally operate within a month.
Yes.
So although we are resource constrained, we have challenges of our own, but when it comes to services, we do our best to provide to alleviate the people's pain and suffering.
Last. Thank you so much, La. Thank you. Heard that Dr. Phub is a very good human. I mean, absolutely, this is what actually I wanted to say. Thank you so much, Doctor. I don't want to, I'm sure there are so many questions, but I'm so sorry. I don't want to keep Doctor for too long. Despite being very busy and like the whole day seeing patients and handling everything, agreeing to come here and spending like an hour with us here. Thank you so much, la. Very informative, and really truly honored to have you, la, Doctor. I hope Doctor will
Yes.
be in Bhutan only. Mo la Doctor di Jigme da lagate.
I hope to stay back.
Last la. We need more doctors like you, la. Namsami kadichela. Doctor, any last word of advice to the viewers, la?
I think the one thing that I didn't cover is about late presentation. So before I go, I will stress on late presentation. That is again one of the main challenge that we have, late presentation of disease. So from the system point of view, we also have to intervene to tackle with late presentation in terms of educating patients, in terms of letting people make informed choices, in terms of screening facilities, going out to community screen for disease. But at the individual level, we can also take your own steps, being aware of the common symptoms. Because in Bhutan, our health-seeking behavior is not that proactive. We wait for the last moment. So, you may be very good at maintaining your car. Once it reaches 5,000 kilometers, you might go to the workshop, you might, change the oil filter, do this and that. But when it comes to your own health, you are not that good in maintaining. So that if you maintain properly, if you take the correct steps, then you can prevent a lot of diseases. And late presentation, especially in cancer, if you see the current trend in cancer, almost 70-80% of the cancer that we see are actually in late stages. That's why the prognosis is very bad. So the common belief is that when you have cancer, you die. But that need not be. It all depends on the stage at which you are diagnosed. And currently, unfortunately, most of us, the presentation of cancer at the hospital is very, very late. So late presentation is something that we are dealing with, but with the effort from everybody at the individual level, in terms of proactive health-seeking behavior, in terms of being aware of common symptoms, in terms of being aware of the lifestyle related factors which can contribute to disease. All these are important, and your small step can go a long way in not only preventing your health issues, but also causing less burden to the government in terms of healthcare expenditure. So this is something I think we all as individuals can take small steps, but it can make a big difference in the long run.
Doctor, do we have this kind of a service in Ngachigi hospital now where they provide like a package checkup la, full checkup pe, just general checkup pe, yuya la mimo la Ngachi Bhutan?
So general checkup, I'm sure you must be referring to some of the packages that the corporates outside offer. So outside they have a package like this, but here it will depend. It has to be customized. We cannot offer a package as such, but it will depend on, for instance, your sex, your age, your risk factors. So based on this, we can customize the screening tool for you, especially if you come for blood tests. It will depend on all these factors. Now, if you pay for the service, then that's different. Then basically you will end up being, they will do from head to toe. But here, of course, we have whatever tests being done outside, we have it here, but it has to be customized based on our, to optimize our resources basically. But we do have it.
Plus, anizumbe service chiyo wachimola where we pay and have like package pay, because a lot of Bhutanese they actually don't mind paying imewala as long as it's just within next door and don't have to travel all the way out. Anizumgi service china Bhutan na yobachi
So
that would be very good.
I think the sharing of healthcare burden in terms of financing. How do we make our healthcare more sustainable? How can, as individuals, take responsibility for your own health, even in terms of financing? How do we, as individual citizens, how do we share the burden of the healthcare expenditure? I think that is a very important topic. I think we can have another session of discussion on that. But definitely that is something I think we, as even within the system, has to look forward to see how do we make our health system more sustainable in terms of financing, and how do we involve cost sharing mechanisms, like for example you said about the packages. Yes, definitely we have the facilities, we can design packages where people are willing to pay for the services which is same. So this is something which we can really focus.
Since doctor mentioned NCDs are on the rise, no la. So to curb them, maybe one of the way out could be providing like health screening packages where people, if you have noticed la ngachi mi disu kati turutio analu we take it more seriously me wala. So asise turuti sisa go bezoja wachi maybe people start taking their health seriously la. Anyway, thank you so much, La Doctor. Thank you so much. I think we'll just keep it to this much, La Doctor. I really, really appreciate you taking the time out and coming here, sharing your knowledge and your experience and answering some of my questions. I really appreciate that. I wish you all the very best, La Doctor.
Thank you so much for thank you so much for giving this wonderful opportunity on your very popular platform for me to share some insights from the health system and see how we can together we can make our health system better, because I think especially with regard to hospital, I feel we all can have shared responsibility in terms of making lives better for everyone, especially when we avail health service. So I really want to thank you for the opportunity to share my thoughts on your platform. Thank you so much.
Thank you, La. Thank you so much, La. Thank you, La. Yeah, La Soul, Anamsami Kadiche. Thank you for watching. I think I kept Doctor way longer than Doctor was asking. So anyway, thank you so much for joining, La. I hope Atiti Insight Re, Atiti Anizum information top chimula. So please do take care of your health. NCDs on the rise, so make sure that you're doing your exercises, watching your diet, and all that what we are supposed to do. Thank you so much for joining, and I shall see you on the next episode. Bye bye.